when you enter to the emergency room, almost all the department people will be doing lot of calculation and evaluation, all those things. I done certain studies in hematology in the emergency room. One among is that it is the IRF in different critically ill fever patients. So IRF, as all we know that it is an immature reticulocyte fraction. It's a relatively a new reticulocyte parameter available in a automated instrument. It assesses the maturity of the circulating reticulocytes, and it's quantifying the fraction that stain the strongest among the strongest of RNA. And IRF factor has significant clinical application in hemolytic anemia. Or we can know about the regeneration and non-regenerating conditions we can assess it. And here what I done it on the fever in a critical patients. And it assesses as all we know, the reticulocyte maturity can be assessed by the IRF, whereas the absolute reticulocyte count for severity of the anemia can be assessed. But when you combine with both, you can assess total marrow erythropoietic response can be assessed. The aim of the study is to hypothesize that IRF could provide a diagnostic information to evaluate and management of patients with infectious conditions like dengue, lepto, H1N1, and COVID-19 being evaluated. And specifically, the IRF quantify the fraction of circulating erythrocytes. And the marrow excites and at least mature, we speculated the changes in the IRF. Changes seen in the reticulocyte count in the infectious crisis and its recovery phase also. A big change in the values we are seeing it. And the method, I studied about 88 cases in a critically ill fever patients in an emergency room which came in our hospital during the period of 2023 to 2024. And total of 44 dengue patients were there in it, and 20 were H1N1, and 16 were COVID patients, and 8 were the leptospirosis. And we studied the reticulocyte indices were measured in Mindray 6800 plus automated cell counter. These values were analyzed and correlated with biochemical and serological and molecular, and compared. A lot of analysis we have done it. The cases was stratified into different etiological group also, like these infectious conditions. The result you can see here in a fever, different stages of fever, like in acute phase of fever and critical case and recovery phase and coalescence phase. You can see here in a dengue, lepto, H1N1 and the COVID. In the dengue, very low IRF value is seen. I have given a very wide range of IRF value, that is 1.1 to 11.4, and it is not standardized as such. So with a mean of 4.7%. Look at here, leptospirosis and the H1N1. There is no lower value is not. That you can see it in even though the in dengue patients it's showing a very low value of IRF. So in a dengue viral infection, it affects the thrombocytopenia, it affects the thrombocytosis, but it's also affect the erythropoiesis. It's not lowering, is it? It increasing the HB percentage, and the hematocrit will be increased. So it is not. Is it really affecting the production? I doubt about. There is no. It is not affecting the production of. So IRF is very low in this case. So simple hematological parameters with IRF you can expect to be able to indicate how active the erythropoiesis in bone marrow in these infectious conditions. And these are my values in different fever cases. I mean, in dengue patient. And the IRF in the fever phase is lowest, and compare with the other phase also, and the critically ill patient also, it is normal, around 4.7 low only, but not as low as the dengue patient. So in conclusion, IRF is a newly routine parameters in hematological analysis, the retic mode, and which gives an idea about early morphological change in the marrow. So need to evaluate dengue patients the suppression of bone marrow either directly due to the cytokine or high RBC count and high hemoglobin can reversely suppresses the IRF. And this, I don't know, we need to do the cytokine analysis to differentiate these conditions, this cause of the suppression of IRF. And that's my message to this talk. Thank you.